Welcome to Dr. Health Hub, where every episode begins with a doctor tip you can trust. Today, we're talking about a problem that many people feel embarrassed to discuss: constipation. It's more common than you think, and understanding it can make a big difference in your daily comfort and health. Doctor, can you explain what constipation actually means?
Of course. Constipation is when a person has fewer than 3 bowel movements per week, or when stools are hard, dry, and difficult to pass. It's not just about how often you go, it's also about how easy or difficult it is to go. Some people may still go every day, but struggle with straining or a sense of incomplete emptying. So constipation is really about both frequency and stool consistency.
That's clear. So, how common is constipation?
It's very common worldwide. According to UpToDate and the World Gastroenterology Organization, around 15 to 20% of people experience chronic constipation. It affects women more than men and becomes more frequent with age. Children and older adults are especially at risk, and it's also very common during pregnancy.
Why does it happen? What are the main causes?
Constipation has many possible causes, often a mix of lifestyle, diet, and medical factors. The most common reasons include low fiber intake, not eating enough fruits, vegetables, and whole grains, not drinking enough fluids. Dehydration makes stools harder. Lack of physical activity. Movement helps stimulate bowel muscles. Ignoring the urge to go. Holding it in too often can slow the bowel reflex. Medications, like some painkillers, like opioids, iron supplements, and certain blood pressure drugs can cause constipation. Hormonal or metabolic conditions, thyroid problems, diabetes, or pregnancy can slow digestion. Gut conditions, like irritable bowel syndrome, or IBS, or structural issues in the colon.
So even daily habits can make a big difference. What symptoms or warning signs should people watch for?
Good question. The main symptoms include fewer than 3 bowel movements per week, hard, dry, or lumpy stools, straining or pain when passing stool, a feeling that not everything came out, abdominal bloating or discomfort. Some people also experience loss of appetite, nausea, or mild fatigue when constipated. However, there are red flag symptoms that require a doctor's evaluation right away, such as blood in the stool, unexplained weight loss, severe abdominal pain, or sudden change in bowel habits, especially in older adults.
That's really important to highlight. How do doctors confirm that someone has constipation and not something more serious?
Diagnosis starts with a careful history, asking about diet, medications, and bowel patterns. A physical exam may include checking the abdomen and sometimes a rectal exam. If constipation is long-standing or severe, we might order blood tests, imaging like an abdominal X-ray, or a colonoscopy, especially if we suspect blockage, inflammation, or colon cancer. In some cases, special tests can check how the muscles and nerves of the rectum and colon are working.
So, once the cause is found, what's the best way to treat constipation?
Treatment always starts with the basics: lifestyle and dietary changes. Increase fiber intake. Eat more fruits, vegetables, beans, and whole grains. Aim for about 25 to 35 grams of fiber per day. Foods like apples, pears, oats, and chia seeds are great natural sources. Stay hydrated. Drink enough water throughout the day, especially when you increase fiber. Fluids help soften the stool, making it easier to pass. Move your body. Regular physical activity, even walking 15 to 20 minutes daily, helps stimulate the intestines. Create a routine. Try to go to the bathroom at the same time each day, ideally after meals when your bowels are naturally more active. Don't ignore the urge to go. If these steps don't help, we may add medications such as bulk-forming agents, like psyllium or methylcellulose. Osmotic laxatives, like polyethylene glycol or lactulose. These draw water into the stool. Stimulant laxatives, like bisacodil or senna, used for short periods. Stool softeners, like Docuset sodium, useful for mild cases. For chronic constipation that doesn't respond to these, doctors may consider prescription medications that help stimulate bowel movement more effectively.
That's very practical advice. Are there risks or complications if constipation is ignored for too long?
Yes, especially in chronic cases. Long-term constipation can lead to hemorrhoids from straining, anal fissures, small tears in the rectum, rectal prolapse when part of the rectum slips out of place, fecal impaction when stool becomes stuck and hard to pass, sometimes requiring medical removal. It can also cause significant discomfort, reduce appetite, and affect mental well-being due to the ongoing stress and bloating.
That sounds serious, but also preventable if people act early. What can we do to prevent constipation in everyday life?
Most cases can be prevented with small daily habits. Eat a balanced diet rich in fiber, drink water regularly, stay active. Walking, stretching, or light exercise helps. Don't delay bowel movements when you feel the urge. Limit processed foods and excessive caffeine or alcohol, which can dehydrate you. Review medications with your doctor if constipation becomes a side effect. For children and older adults, routine and hydration are especially important.
And for education, what should patients remember most?
They should understand that constipation is common, treatable, and rarely a sign of something dangerous, but it should never be ignored. Early lifestyle changes can make a big difference. Avoid overusing laxatives without medical advice, as this can weaken the bowel over time. And if symptoms persist beyond 2 weeks or are accompanied by bleeding or weight loss, see a doctor promptly.
That's excellent guidance. So, to summarize, constipation is a common condition that happens when stool moves too slowly through the colon or becomes hard to pass. It's often caused by low fiber, poor hydration, lack of movement, or certain medications. Treatment focuses on fiber, fluids, exercise, and if needed, safe use of laxatives under medical advice. Prevention through healthy habits is key.
Exactly. Constipation can affect anyone, but with awareness and small changes, it's almost always manageable.
Thank you, doctor, for explaining this so clearly. And thank you to everyone watching Dr. Health Hub. Don't forget to like, share, and subscribe for more trusted health tips.
And remember, your health is your wealth. Stay tuned for the next doctor tip you can trust.